Welcome to your Health Oasis, your complete healthcare guide. White discharge is often a cause of worry in many women, wherein they misinterpret it to be the outcome of some underlying infection of the uterus or vagina, which is absolutely not true. First and the foremost fact to be understood is having white discharge is absolutely normal. The vagina in women is a naturally self-sterilizing organ, as a part of which it produces a white sticky discharge which is completely natural and normal, which also helps in lubrication and preventing infections. The normal vaginal pH in a healthy woman is about 4 to 4.5. The odorless bacilli, which are the lactobacilli that reproduces in the vagina and are responsible in maintaining the normal acidic vaginal pH. It does so by converting glycogen in the vaginal mucosa into lactic acid, as a result of which a white sticky coagulated material is produced, which is then secreted out as white discharge. Normal vaginal discharge is a clear, watery, odorless, and non-itchy discharge which varies as per the days of your menstrual cycle. During the initial days, just after your periods, the discharge tends to be very thin and watery. It then takes an egg-white consistency, becomes more thin and more stretchy during the time of ovulation. Many women use this to keep a track of their ovulation. During the later days, the discharge becomes thicker, more whitish, and takes a creamy consistency. The amount of normal vaginal secretions varies with age, in health, and in disease. We shall now see the normal physiological causes leading to an increase in the vaginal discharge. Pregnancy increases white discharge and it is maximum in the early days of pregnancy. White discharge is seen to increase three-folds around the time of ovulation, that is, around the 14th day of menstrual cycle. Under estrogen stimulation, the odorless bacilli convert glycogen into lactic acid. A surge in estrogen levels promote the secretion of a normal clear discharge, keeping the vagina, vulva, and urethra healthy. Chronic constipation and sedentary lifestyle that leads to congestion of the pelvic organs also aggravate white discharge. When your white or clear, odorless, and slippery vaginal discharge suddenly turns into a foul-smelling, excessively itchy, and discolored discharge, the time has come where you need to seek medical help. An excessive increase in the white discharge, where the underclothes are soiled and may require frequent changing or wearing of some extra absorbent pad or panty liners, may not always be pathological or infected, but seeking medical help is definitely recommended. Other alarming symptoms include excessive itching, burning in the vaginal area, foul-smelling discharge, pain in the vagina or severe pain while urinating, fever, and rashes over the vaginal area are all symptoms calling out for medical help. When the discharge is of a clumpy, whitish, curd-like consistency, it must raise the suspicion of a fungal infection, also called candidiasis or vaginal yeast infections. It occurs at a higher incidence in women who are diabetic, taking oral contraceptive pills, or steroid medications from a long time, also due to poor personal hygiene. Pregnant women have an increased risk for vaginal fungal infections. Grayish-yellow discharge with a fishy odor is commonly seen in bacterial infections called bacterial vaginosis. The causes include increased alkalinity in the vaginal pH, making it easy for the bacteria to harbor. Smoking and alcohol consumption also make women easily prone to such infections. Brownish or blood-stained vaginal discharge outside your periods is alarming. It may simply be due to hormonal imbalance, which is particularly seen in teenagers and during menopause. Blood-stained discharge during pregnancy poses an ultimate need for urgent medical help. Women who have an intrauterine device inserted may have blood-stained discharge due to the local trauma or any hormonal imbalance. It could rarely be a sign of any kind of serious illnesses such as cervical polyps, endometriosis, or cancers of the genital tract. A large amount of thick, foul-smelling greenish or yellowish discharge is seen in trichomoniasis infection, which is a sexually transmitted disease that causes pain and itching around the vaginal area, along with pain while urinating. Thick yellow pus-like discharge is seen in gonorrheal infections. It is a sexually transmitted disease that leads to pus-like discharge while urinating, menorrhagia, or bleeding in between your periods. Kindly consider to like, share, and subscribe the channel if this information was useful to you, and do not forget to hit the bell icon. Follow me on Instagram for some daily